G'day and welcome back to the channel. So in today's video, I want to help you better understand what your pain is telling you so that you hopefully stand a better chance of getting rid of it long term. And obviously as a physiotherapist, the reason why I have a profession, and to a lesser extent the reason why this channel exists, is to try and conquer that pain and hopefully get it to not want to come back again in the future. So what I want to go through in this video is I want to touch on some common words and descriptions of pain, and then delve into what that might actually represent and what it might need you to do to resolve that pain long term. So the very first thing that's vitally important to understand about pain is what it is. For decades, we used to think that the only reason that you deserve to have pain is if you have sustained some tissue damage or injury. If you are someone who has torn a muscle or broken a bone or bulged a disc or damaged a nerve, logically it makes sense that your brain produces pain as a protective mechanism to help you best recover from that injury and damage as quickly as possible. And with this in mind, we would obviously respect pain because it gave us the boundaries to help us understand what is good and bad for our tissue in the moment while it was injured. But what this never actually did is this never helped us explain why so many people can have horrible, intense, persistent pain, but yet have nothing to show for it in terms of injury and damage, especially on scans. But over the last 10, 15, 20 years, we've come to understand that pain isn't necessarily representative of damage and injury, but it's actually representative of your brain and nervous system's perception of threat. Now that perception of threat can obviously encompass tissue damage and injury, but it's no longer exclusive to that. We now have this broader understanding that the reason why your brain and nervous system generates pain isn't because it's damaged by default, but because it feels threatened to some degree. So if you're ever wondering why a scan may not show anything that represents your pain, it may actually mean that there is not a damaged or injured area that does represent your pain. Your pain is still very real in every instance, but we know now that you can have a lot of intense pain if your tissue is irritated, overloaded, if something is stiff and jamming up mechanically. We can have referred pain, which means your pain may be coming from somewhere else. Because pain is essentially a representation of how threatened your brain and nervous system feel, anything else around you in your environment, in your current life that also causes you stress, frustration, anxiety, that makes you feel threatened to some degree, can also wash back over your symptoms and heighten those symptoms and influence the pain that you experience. And while damage and injured tissue can certainly generate that threat, your environment around you can also contribute to how bad that feels for you. And this is why understanding what pain actually tends to represent is really important if you're trying to get rid of your pain short and long term. Because if you're barking up the wrong tree or you're going down a path that ultimately and intuitively sounds logical, but might just be a little bit away from what your body's actually going through, then it becomes so much harder for you to conquer that pain quickly and permanently. So let's talk about some of the most common types of pain that you may be experiencing in the hope that it can help guide you to a better place with your current dysfunction. So one of the most common pain labels that I would hear clinically as a physiotherapist is a sharper type pain. So this pain typically represents injured tissue or a mechanical dysfunction. Either way, this pain needs to be respected, because if you force your way through this pain or try and push past this pain, we can't promise you that you aren't doing yourself more damage. So for example, if you are someone who takes your arm out to the side and you feel a sharp, stabbing, specific pain in your shoulder, it's very likely that there is some tissue in that shoulder that is torn, injured, or at the very least irritated in some way, and doing more of that motion is unlikely to make it magically feel better. From a mechanical perspective, if you have a lot of stiffness and tightness in certain parts of your shoulder, unless you take away that mechanical handbrake, you're going to be consistently irritating and annoying that tissue, and again, potentially making it worse over time. With this sharper type pain, it's really important that you take a step back to try and understand why that tissue has become injured or mechanically dysfunctional in order to stop this issue from coming back again in the future. And on the flip side of this, another common descriptive term that I would hear clinically a lot as a physio is a broader, non-specific type pain. This pain can also be represented as a deeper type feeling, something that you can't quite put your finger on, that almost feels out of reach. The interesting thing about this type of pain is that this type of pain is highly likely to be referred from somewhere else. And what can be tricky about this type of broader, deeper, hard to localize pain is that the area that it's being referred from is likely to feel completely asymptomatic to you. You may have no idea that this other part of your body is dysfunctional, you just feel the consequence of that dysfunction somewhere else. So commonly we see a broader type pain with lower back pain, where if you feel you have a band of pain across your lower back, or there's a pain at the top of your hip or the side of your hip that you can't quite put your finger on, but you know that it's definitely there. This type of pain is often being referred from the base of your thoracic spine or the base of your rib cage. So the one thing that I urge you to do, if you do feel like your arm, leg, back, hip, shoulder, neck, or head pain feels very non-specific and it's hard to localize, you can't put your finger on the exact spot that hurts, do yourself a favor and Google one of two things. The first are dermatomes. Dermatomes are fetal connections that develop when we're developing in the womb that are essentially leftover spinal connections that relate to our skin and our superficial tissue that have a very strong association to individual segments of your spine. So if you know where your pain is and you Google dermatomes of the lower leg, the back, or the upper limb, or even the head and neck, you might be able to find whereabouts your pain might actually be coming from, and then you can get to work on looking after that particular section of your spine. That section may need to be mobilized or stretched or better positioned or strengthened in order to decrease the reason for why it's expressing itself to the dermatomes that it might be connecting to. The second thing to look for is, if you know where your pain is, look for the nerve that supplies that tissue specifically, and again, chase that nerve back to the segment or segments of your spine that it might be coming from, and again, get to work on improving the function of that area. So for example, if you are someone who has persistent calf pain, where it's like a broad sort of non-specific pain in your calf, that tissue is supplied ultimately by the sciatic nerve. Depending on where in your calf that you feel your pain, might depend on which branch of that sciatic nerve, whether it's the tibial aspect of the nerve, whether it's a peroneal nerve that comes off from that sciatic nerve. But ultimately that sciatic nerve comes from the bottom levels of your spine. And again, it doesn't necessarily mean that you have a disc bulge or that you've got a lot of arthritis and are compressing a nerve in your back or that you've done some damage. But what it does mean is there might be some specific dysfunction of that segment or segments of your spine that you can go after that might tangibly change how your calf symptoms feel straight away and give you more confidence you can understand why that tissue is uncomfortable in the first place. Following on from this, if you feel that you are suffering from a burning type pain where it feels hot or tingly or even cold, then this is typically associated with a neural type dysfunction. So again, similar to that referred pain that we spoke about, a burning type symptom might also be a referred symptom based on the nerve that supplies that area becoming dysfunctional in some way. Now, the burning pain doesn't necessarily tell us why there's a problem, but it does give us somewhere to look to try and find out what might be going wrong. So again, if you are having a burning type feeling in your calf, and we know that that calf muscle is ultimately supplied by your sciatic nerve, then if we go hunting all the way along the course of that nerve, looking for the tissues that the nerve either passes through or associates closely with, then again, we might be able to find something that might be contributing to those neural symptoms. Another type of pain that I come across clinically all the time is an aching type pain. Now, you may know that aches generally represent some form of inflammatory type dysfunction, where if you've sprained your ankle, it's swollen up, it's red, it's quite sore, it's quite tender. It may also ache particularly of a night time and frustrate you throughout the night. But interestingly, an ache may also be suggestive of referred pain. So if you haven't had a specific acute trauma or injury where it's very logical to assume that your ache may be related to inflammation of some sort, if a part of your body has just started aching for seemingly no reason, again, come back to your dermatomes and your nerves and go looking for the origin of those tissues to see if there's something there that you can do to affect your achiness somewhere else. Because again, typical signs of inflammation might be that a superficial area could be red, it could be hot, it could be swollen, but also if that tissue is a little bit deeper and you wake up stiff in the morning or your night pain increases, again, these are traditional things that we would associate with inflammatory type pain and may require you to get an anti-inflammatory of some sort to try and get that pain under control. But again, as we've spoken about in a recent video, inflammation is normal. It's a normal part of the healing process. So if you are taking something to settle down inflammation, we need to make sure that you're understanding that you may also be delaying the healing process at the same time. So there comes a point where you need to make an adult decision where if your pain is so severe at night that you can't sleep or that it's limiting you from doing the things that you have to do day to day, then an anti-inflammatory might be useful to help you manage the things that you need to do better. But if you are taking anti-inflammatories just because, and you might find without them you could manage the pain, then please try and do that because it might help you get through this pain faster at the end of the day. Now, another interesting component of pain that I see clinically all the time as a physiotherapist is pain that comes and goes or pain that shifts around. Now, logically, if you have a specifically injured tissue where something is broken, broken or damaged, or a disc is bulging, or a ligament is torn or something like that, then realistically your pain should be in the same spot all the time. It may increase the more you load up that tissue, it may decrease the less you load up that tissue, but if your pain shifts around, it's suggestive of pain that's coming from somewhere else as well. Again, this can be a referred type pain. But there is a little nuance to this conversation. If you are someone who originally sprained your ankle or broke your ankle, and you have that very specific pain that originated from your injury, other parts of your ankle, other parts of your leg can start to become sore based on how you're loading them up. So while you still might be in pain after 4 to 6 weeks, the pain that you've experienced from the damaged tissue may actually have healed, but it's been replaced with more mechanical type dysfunction. And you might have developed some tight muscles in the area, some of your joints may have stiffened up, something may become a little bit more swollen or a little bit weaker. And as you quickly reclaim that function, you might find that that newer sort of different type pain may resolve a lot faster. Following on from this, if your pain is consistently there, but inconsistent movements bring it on, then this might be suggestive of more of a mechanical issue rather than just an injured piece of tissue. And what I mean by that is, if you are someone who has shoulder pain and you might do the same movement 5 or 6 times, and 2 or 3 of those generate that specific sharp pain of yours, but another 2 or 3 do not, then you might find it's the subtle variations in how you move through that range that might determine if something gets irritated or annoyed. Again, you can still have some injured tissue in that area, but what it means is that the mechanics of the area ultimately might be determining whether you expose that dysfunction in the moment. And this is really important because much like most sharper pains, there might be something you can do to the surrounding tissue in terms of loosening it up, strengthening it, putting it into a better posture or position that might ultimately make it easier for you to tolerate that pain or to live with that issue while it settles down and goes away. And those mechanical based sharper type pains can also be described as like a catching or a jamming, especially when you're dealing with the spine. If you're someone who turns your head and you feel a sharp pain and a catching type feeling more than a tightening and a restrictive type feeling, that may suggest that the joints of your spine are jamming up mechanically and requires you to find where around those joints might be stiff, tight, or restricted to release those handbrakes to feed some slack back into that irritated and injured tissue to ultimately allow it to settle down as quickly as possible. So having covered some of the more common descriptive terms for pain, there's 2 other features of pain that we need to circle back to that will hopefully help you better understand everything in its entirety even more. So not only are the labels really important, but so is the intensity of your pain and the duration of your pain as well. So coming back to that initial description of pain that I threw at you at the top of the video, if we understand that pain is just an expression of your brain and nervous system's perception of threat, we're looking at sharper pains, duller pains, achy pains, pains that come and go, pains that aren't consistent, burning type pains, all these types of aches and pains. They are just your brain and nervous system's way of communicating some type of threat to you. How threatened your nervous system is before we introduce those musculoskeletal dysfunctions can again determine how intense or how long that pain hangs around for. So when trying to understand why the pain that you experience is intense or not intense, it has nothing to do with your pain tolerance, how strong you are as a human, how weak you are as a human. It's not about those things. It's just a representation of how heightened and threatened and on edge or aggravated your nervous system is potentially before that symptom even existed. So if you are someone who has a pain that's anywhere from a 5, a 6, 7, 8, 9, or 10 out of 10, it's really important to understand that your pain isn't just about the tissue that you are dealing with. It's very likely to be a consequence also of a nervous system that is also heightened. So it's really important to take a step back and try and figure out what might be heightening your nervous system and ultimately dialing up the consequences of your pain. Is there some financial stress there? Do you have some relationship stress? Are you unhappy? Is there something else going on behind the scenes that is already heightening your nervous system, dialing it up, and then turning the potentially lesser symptoms that you could be dealing with into that monster? And again, it's always important to respect your pain in its entirety. If you have a specific issue or some damage that has shown up on a scan, it can still be dialed up by any of those peripheral stresses or challenges or threats that you might be dealing day to day in your broader life. Again, it's also important to understand that it may not be something that you are currently dealing with. It might be something you're stressed about dealing with in the future. It might be something unfortunate that you've dealt dealt with in your past that is lingering and festering behind the scenes without you ever really noticing. Again, heightening your nervous system and changing the consequences of your pain. So ultimately, this conversation is about making sure that if you can better understand what might be causing your pain, not even from a specific tissue perspective, but ultimately as you as a human being, then you can take tangible, intuitive steps to try and change those things. If your nervous system is heightened and you feel like the intensity of your pain, the persistence of your pain is greater than it potentially could be, we want to get you to do some things that de-escalate that nervous system and shift it down a few gears. We've gone through this in previous videos, and I won't go through in too much detail in this video, but things like deep breathing, cold showers while deep breathing, getting out into the sunshine, exercise, doing things that make you happy, things that you know de-escalate a heightened nervous system and relax you, can be viable strategies to turn that dial back down and potentially immediately influence the severity, the intensity, or the duration of your pain. As you can hopefully understand in this video, pain is more and will always be more than just local tissue damage and injury. It might also be heavily influenced by what your nervous system is doing. So as always, I genuinely hope that was helpful. Pain can be a very challenging and frustrating thing to deal with. Please let me know in the comments down below what type of pain you are experiencing and where you think that's coming from, or what type of pain do you think that is. But once again, thank you for watching, and I hope to see you in the next one. Bye.